How do PCSK9 inhibitors treat familial hypercholesterolemia, FH? Imagine a tiny protein in your body that can influence how much bad cholesterol is floating around in your blood. That protein is called proprotein convertase subtilisin/kexin type 9, or PCSK9 for short. When it binds to low-density lipoprotein receptors on liver cells, it causes these receptors to be destroyed. These receptors are like the body's cleanup crew, removing bad cholesterol from the blood. When they are destroyed, cholesterol levels go up, which is a big problem for people with familial hypercholesterolemia. Familial hypercholesterolemia is a genetic condition where people have very high levels of low-density lipoprotein cholesterol because their liver cells don't have enough functioning receptors. This makes them more likely to develop heart disease at a younger age. Traditional treatments like statins work by telling the liver to make less cholesterol and by increasing the number of LDL receptors. But sometimes, especially in severe cases, statins alone aren't enough to bring cholesterol down to healthy levels. That's where PCSK9 inhibitors come into play. PCSK9 inhibitors are a type of medication that blocks the action of the PCSK9 protein. They are usually given as injections, either once every 2 weeks or once a month. These drugs are monoclonal antibodies, which means they are lab-made proteins designed to target and bind to PCSK9. When they do this, they prevent PCSK9 from attaching to the LDL receptors. Without PCSK9 binding, the receptors are not destroyed and can be recycled back to the surface of liver cells. This means more receptors are available to grab onto and remove LDL cholesterol from the blood. For people with heterozygous familial hypercholesterolemia, which means they have one copy of the faulty gene, PCSK9 inhibitors can lower LDL cholesterol levels by about 50 to 60%. This can help many reach their cholesterol goals when used alongside statins or other medications. In cases of homozygous familial hypercholesterolemia, where both copies of the gene are affected, the response to PCSK9 inhibitors can vary. If the patient has some functioning LDL receptors, they might see some benefit. But if the receptors are completely non-functional, these drugs may not work as well. These medications are generally well tolerated, with the most common side effects being mild injection site reactions, like redness or swelling. They are especially useful for patients who cannot tolerate high doses of statins or who do not get enough cholesterol lowering from other drugs. Doctors often prescribe PCSK9 inhibitors as an add-on therapy for patients with familial hypercholesterolemia who still have high LDL cholesterol despite taking maximum tolerated doses of statins. Looking ahead, researchers are working on oral versions of PCSK9 inhibitors, which could make treatment easier and improve adherence. These drugs work by blocking the PCSK9 protein, which helps preserve the number of LDL receptors on liver cells. This process boosts the liver's ability to clear bad cholesterol from the blood, tackling the core issue in familial hypercholesterolemia. Overall, PCSK9 inhibitors offer a powerful option for managing this inherited condition and reducing the risk of heart disease.